Hello, this is Gregory Zengo, the founder and medical director of Practical CME Medical Training. In the next few minutes, I will show you how Practical CME could change your career and change your life, and why you should start here today. When I trained in aesthetic and wellness services over 15 years ago, I dug around classified ads to find physician preceptorships in Botox and sclerotherapy. We met in his office and watched a few treatments. Okay training, but no CME credits or printed syllabus. I also attended a large group training, dumped thousands of dollars, showed up at a sketchy hotel where a non-MD instructor read directly from the slides. And they gave a third-generation photocopy syllabus that was useless. Horrible training with a certificate printed from a Microsoft Word template on an inkjet printer that was still not back with real CME credits. In the end, I had to read every book and article to feel comfortable doing the procedures. There had to be a better way. And that's why I started Practical CME back in 2008. Our courses are live streaming webinars, fully online that you can watch at your own pace, or a blended online with live hands-on format that we call Fast Track Training that you can start today. The entire curriculum is given at the time of purchase and watch at your own pace as often as you need to learn the protocols. Once the post-test is passed, a fully accredited certificate is earned for the online section, which you can then print at home. Then the hands-on date is mostly devoted to one-on-one supervised practice of the procedure with a more advanced review and Q&A of the online curriculum. This blended approach is far superior than trying to learn the entire procedure in just one day, coming into the training cold where you know you only retain about 10 to 20% of what you hear. Fast Track Training will have you ready to practice on Monday once you get home. And you get real certificates with real CME credits clearly stating your hands-on training along with an authenticity seal. Will your live course be so crowded that you can't even get 5 minutes of time one-on-one with the instructor? Here's what most training courses look like. And if they sell out, they just tell the hotel to book a bigger room and add more seats. Practical CME's live courses are capped at 6 attendees or less. Our capacity is clearly stated on each live date. And as we get close to hitting our max, we warn you and then we mark the course sold out. We have only a few dozen live seats to our Botox and filler live hands-on courses per year, and that's our most popular course, under 100 seats per year. We've always catered to the most motivated nurses, mid-levels, and MDs and DOs who are ready to practice right now. You want to learn it well. Get 2 real AMA CME certificates, one for online and one for hands-on. Then reserve your seat today and start learning online tonight. Before I leave you, I want to answer 4 common questions. First, as a nurse or mid-level, do you already have to be in an aesthetic practice to take your course? The answer to that is definitely no. We encourage RNs, PAs, and nurse practitioners to take our courses first and add it to your resume before looking for that job. Attendees report signing bonuses greater than the tuition cost and faster time to hire after putting our courses on their resume prior to that job change. You will be more competitive being trained already. And remember, your online content remains active for at least 2 years, giving you time to review again. Next question. Why do we teach so few courses when other companies teach 30 to 40 all for one low price? Of course, you have to take enough time off to travel to all of them. That one is simple. Because for most of those services, they're either not safe, not effective, or they could put you in debt. Many of those classes are sponsored and depend on expensive lasers or proprietary, sometimes multi-level pyramid scheme supplements, or even dangerous hormone pellets, which can cause a huge initial expense, risk, and maybe never get profitable. At Practical CME, there are no sponsors controlling what we teach. We teach skills over sponsors. Next question, bring it on. $2,000 for training seems like a lot to spend. Is it worth it? Practical CME gives you value in 3 ways. First, we use real product for our hands-on at no extra charge to you. Our Botox and Fillers course includes $600 of real Botox and Juvederm. At other trainings, the Botox and sometimes even the gloves and needles aren't provided and cost extra. What? Here's another way to look at it. Let's say you launch your new service slowly and only attract 1 new patient per week. With routine follow-up visits, any of the skills we teach will generate between $30,000 and $50,000 in 1 year alone. Now imagine what might happen if you attract 3 new patients a week. This is why 70% of our attendees pay a few $100s and travel from out of state if they're able to snag a seat at one of our live courses. Finally, other providers are hastily throwing together video classes in 2020. Not us. All of our online courses have been built solely for online learning since 2014 and are fully interactive. Here's our viewing interface. You can stop and resume at any time and it remembers your place. Controls for the narration are down here. You can search and jump around to different sections here. Clickable links and procedure videos are opened here. And the drop-down has downloadable consent forms, printable syllabus, and more articles. Courses are updated frequently and the updates are pushed to you at no charge for 2 years. Nobody else does this. This is how Practical CME gives you the most value for your tuition dollar. Finally, I'm going to leave you with this. Call anyone else's 800 number. Will you get an intelligent answer to your question? Will they even answer? Now go to PracticalCME.com and hit our chat button at the bottom right corner of the page. If it's during work hours, you'll get an answer, and you just might speak directly with me. Go ahead, try it now. Ask a tough question like, what do you feel are the pros and cons of sclerotherapy foam agents compared to liquid agents? Hit the button. And if you do have to leave a message, you'll see how fast our response is, usually within an hour during the day, with 12 hours on weekends and holidays. These are the many factors behind the Practical CME difference. As soon as you register, you will have direct contact information with your experienced MD instructors. And remember, if you're an MD or DO, you have to be trained by an MD or DO. Let's help you get started on that life-changing and career-changing opportunity right now. Fast Track Online and Live Blending Training, only a few dozen seats per year. Order now, start learning tonight, and we'll see you at one of our live dates soon. You've worked hard to get this far in your career. Don't settle for less for that next most important step. Let the experience of Practical CME help you get there with confidence. Thanks for listening. Bye.